Hey, it's Jay Diana Messiah, and welcome back to Healthy People Too. Fixing erectile dysfunction naturally. There are more than 600,000 new cases of erectile dysfunction each year. Erectile dysfunction, also known as ED, affects men of all ages, but it becomes increasingly prevalent with age. Millions of men struggle with it, but few ever seek treatment. As many as 40% of men experience some degree of ED by the time they reach 40, and it rises as high as 65% by the age of 65. The male sex organ is a kind of sponge that fills with blood when he gets sexually excited. An erection starts in the brain. Something you saw, felt, smelled, heard, or thought made your nerves send chemical messages to the blood vessel in your organ. Your arteries relax and open up to let more blood flow in. At the same time, the veins close up, your organ expands and holds the erection. So, what happens when the brain does not send chemical messages to the blood vessels in your organ? This produces the condition ED. What exactly is ED? ED is usually caused by low blood flow to the sex organ or a problem with the nerves that control erections. This is a result of other conditions such as hardening of the arteries, high blood pressure, and high cholesterol or diabetes. Physical problems such as injury to the nerves or loss of blood supply to the sex organ. Other health problems such as anxiety and depression, side effects of certain medicines, stress, or drinking too much alcohol can all lead to ED. Whatever the problem, ED is incredibly common, and there are a host of natural treatments for sufferers to consider. Some of the common causes of ED. Physical causes of ED are the most common and are related to circulation of blood pressure. Heart disease, high cholesterol, and high blood pressure can all impact the amount of blood flowing to the sex organ. Diabetes contributes to ED by damaging your nerves and blood vessels. Obesity and metabolic syndrome can cause changes in blood pressure also. The body composition and cholesterol may lead to ED. Other conditions that may contribute to ED include Parkinson's, multiple sclerosis, sleep disorder, alcoholism, and drug abuse. Psychological causes of ED. Between 10% and 20% of ED cases have a psychological cause. Because arousal starts in the brain, psychological issues can be a significant contributing factor to ED. Mental health conditions like depression or anxiety can negatively impact your libido, making it more difficult for you to become aroused. Stress can also be a major factor because it may interfere with your brain sending signals to allow extra blood to flow to your sex organ. In many cases, psychological issues develop into performance anxiety, which is and of itself becomes a self-fulfilling prophecy. Natural treatments for ED. Epimedium, also known as horny goat weed, is a herb common to Asia and has been used to reduce cases associated with ED. This herb can also be taken by women to help with loss of libido. Scientists believe that it alters the level of certain hormones in the body, which may in turn improve sexual performance. The Journal of Sexual Medicine studied the effect of epimedium and concluded that those with heart disease should not take it because it can cause irregular heartbeats. Another natural treatment is vacuum constriction devices, which is an alternative to oral medications. Vacuum constriction devices can create an erection using a vacuum pressure. Once an erection develops, a constriction band is placed around the base of the sex organ to maintain the erection. Ginkgo biloba is an herb that practitioners have used for thousands of years to treat a number of health conditions like dementia, anxiety, and poor blood flow to the brain. Proponents of taking ginkgo for ED believe that it dilates blood vessels and promotes blood flow to the sex organ. According to a study done by Columbia University, ginkgo may be effective in helping treat ED that has been caused by taking selective serotonin reuptake inhibitors, SSRIs, medications prescribed to treat depression. They also noted that ginkgo can increase the risk of bleeding, and people who take blood thinners should not take it. L-arginine is another natural treatment, which is an amino acid that scientists in the 1800s first isolated from animal horn. It is incorporated into supplements to increase the amount of nitric oxide in the body. When taken in high doses, L-arginine can stimulate blood vessels to become larger. This improves blood flow, which could help with ED. L-arginine is also combined with glutamate and yohimbine hydrochloride as a treatment for ED. In a study published in the Journal of Sexual and Marital Therapy, researchers gave participants a combination of L-arginine and pycnogenol, a supplement derived from pine bark. After treatment for 3 months, 92.5% of the 40 men enrolled who experienced ED reported achieving a normal erection. Some side effects of taking L-arginine can include stomach upset, cramping, and diarrhea. Red ginseng. Ginseng is another herb that Korean herbal practitioners promote for its ability to treat ED. A theory that red ginseng influences hormones responsible for achieving an erection because it promotes blood flow through increasing the amount of nitric oxide. A 2008 review published in the British Journal of Clinical Pharmacology found that red ginseng was often more effective than placebo when reducing ED symptoms. However, taking red ginseng can cause insomnia, but researchers largely regard it as safe when taken on a short term basis. Yohimbine is a supplement made from the bark of an African tree. Before medications such as Viagra, doctors often recommended yohimbine as a treatment for ED. It works by triggering receptors in the body that trigger the release of hormones, epinephrine and norepinephrine. These can block the effects of other compounds that may otherwise constrict the blood vessels in the sex organ. Yohimbine has been shown to enhance libido and sexual motivation. Some side effects of yohimbine include high blood pressure, rapid heart rate, and anxiety. Another is psychotherapy. For psychological causes of ED, psychotherapy can be beneficial. Cognitive behavioral therapy is a popular method because it helps address negative patterns of thought that can contribute to performance anxiety. ED may be an unpleasant condition that no one really wants to talk about. Failing to acknowledge it won't make it go away. Your best defense against ED is to learn everything you can about it so that you can tackle the problem head on. Thank you for watching this video. Submit your comments and questions in the comments area. If you would like to hear about more healthy tips, please subscribe to the channel. Have a happy and healthy day.